Dr. Vassallo, dear friends, it is with great pleasure to welcome you to this inaugural lecture, which forms part of a series of talks planned and facilitated by the Malta Community Chest Fund Foundation. These lectures share one common goal: to raise awareness and encourage education about issues of healthcare in the Maltese Islands. Such lectures aim to bring about a proactive approach to the Malta Community Chest Fund Foundation by enhancing its work in creating awareness for prevention. This evening's lecture shall be delivered by Dr. Mario Vassallo, who is a consultant gastroenterologist at Mater Dei Hospital and a visiting senior lecturer with the Department of Medicine within the Faculty of Medicine and Surgery at the University of Malta. I am informed that Dr. Vassallo's lecture shall focus on the facts, myths, and doubts surrounding the role of various foods and food constituents, which can result in common gut and abdominal problems. I would like to share some reflections from a layperson's point of view when I think about the effects of our food choices in our health. People sometimes forget just how fundamental our food choices are to determine our overall level of health and well-being. The choices we make regarding the foods we consume affect our health on a regular basis, often with long-term and persistent effects. We are continuously reminded that combined with physical activity, our diet can help us to reach and maintain a healthy weight, to reduce the risk of chronic diseases, to promote mental well-being and sustain a higher overall quality of life. However, I believe that there is much more which we must do to ensure that healthy eating is part of the daily lifestyle practiced by families across Malta and Gozo. Studies are showing that the incidence of obesity and other diet-related conditions are on the rise in various parts of the world. Malta is no exception. I'm sure that we are aware of last year's European Health Interview Survey, which established that more than 1 in 4 adults in Malta, that is, some 26%, is considered obese. We must therefore ask ourselves, both as individuals and as a society, what more can we do to improve this situation? I believe that we must, first of all, encourage greater synergy among a diverse group of stakeholders, including health professionals, food manufacturers, retail establishments and restaurants, environmentalists, and public health authorities. We must encourage our authorities and industries to work together in a way that their work transcends beyond purely political or business interests. It is essential that we place the health, the well-being, and the dignity of the individual and the community at the heart of all our policies. As consumers, we have the right to have more information for our increased awareness and understanding about healthy food. This holistic approach will certainly have an immediate impact on our lives in relation to nutrition and access to healthy food. Secondly, reducing the impact of diet-related diseases will involve the direct and active participation of schools in order to encourage students and their families to make healthier choices in the first place. Education is the key to unlock the possibilities of better long-term health of our society. The introduction of healthy food policies in our schools was a step in the right direction. However, there are other factors that need to be addressed for a better impact on the health of our children and young people. The united efforts of all stakeholders should give an impetus to further the benefits of good nutrition and healthy eating. In the process of this debate, we should ask ourselves, what would our healthcare and medical systems be like if we approached food itself as a potential component in the remedy to various diseases? How would our society change in beneficial ways if we explored socially sensitive models that reduce obesity while also reducing the costs associated with treatment for the results of an unhealthy diet? Would people be more likely to consume fresh produce if their doctors gave fruit and vegetables as part of a prescription, delivering essential nutrients through a process of holistic and person-centered care? Are financially constrained individuals and families able to afford and access a healthy diet based on fruit and vegetables? Let me conclude by encouraging all stakeholders through various initiatives, even such as this lecture, to nurture honest and informed discussions about how each one of us can be active champions for the sustainable health of our families, our communities, and our society. I believe, as many others do, that the health of our nation, as well as its economic prosperity and overall well-being, depends on our commitment to make a sustainable change in attitude and lifestyle, which will be of benefit to both present and future generations. Thank you.